Looking at pharmacotherapy, we have all effective treatments available and subsidized now. We don't have all nicotine replacement therapies that are available here subsidized, but patch, gum, and lozenge are. The microtab and inhaler are available in pharmacies. Nortriptyline's funded, those NRT products are funded, bupropion or Zyban is funded, and varenicline or Champix is funded subject to special authority criteria. So not everyone can get Champix. Now, do I have a... I'll have a slide in a minute which will just go over those special authority criteria. Now, NRT, I probably don't need to touch on. You're all very good at using this. Remember, it roughly doubles your chance of quitting. It is safe for people who smoke. Anyone here quit card provider? Did you get an email from the quit groups just saying, you know, tell your parents or whatever who have NRT to keep it out of the reach of children? Yes, this is just like any other medicine. If you give it to non-smokers, they will feel sick. Okay, I just had a quick look at the literature this afternoon to see if I could find any evidence of a child dying because of NRT poisoning, and I couldn't. There are some of dying from insecticide poisoning, and there are some of them dying from tobacco use, i.e. chewing the cigarettes and swallowing the tobacco. And there are some dying of young children picking the tobacco leaves in the plantations, dying because nicotine's absorbed through the skin. Okay? But if you give NRT to children, they are going to feel sick. And the more they use it, the more sick they'll get. So just common sense advice here. Combination therapy is recommended, so do use combination therapy, patch and gum, patch and lozenge. And all of those products are available either via prescription or on the quit card. There's no maximum length of time you can prescribe or supply NRT for now. That's been removed, so you can technically go on supplying it for as long as it takes. As much as it takes and as long as it takes is kind of my general rule of thumb for this particular medication. Don't please go writing on a quit card 6 months supply, okay, because that's just a jolly waste of resource. I'm just looking to see if there's a marker pen here, but there's not. If one appears later. Oh, yeah, here we go. Whiteboard marker. And just remember now when you're filling out these quit cards, you have to specify the product. Okay, first line. Second line, you have to specify the frequency. Actually, I'll change that to 12. You can't see it? Oh. Okay, this says nicotine gum 4 milligrams. Oh, thank you very much. I should have bought one from my office. Okay. Can you see that? Okay. Okay, so you have to say the frequency. Now, you can tell people to use more or less than that, but that's a blister pack, okay? And so if you say that, then they'll get the full blister pack. So they come in 12 pieces. And then you're going to say how long you want them to supply 8 weeks. And because I'm nice, I always say please at the end, okay? So that's what you need to write on the quit cards now. It's much more like a prescription, okay? But you could technically say supply 24 weeks, please, but it will just sit around in people's cupboards. So better to have short supplies than putting them all in together. And you know about the ABC training, which I don't need to go into. Now, Champix has recently, as in November last year, become subsidized for smokers if they meet certain criteria. Now, Champix is a little bit like nicotine in that it acts on the same receptors as nicotine does, but it's not as strong as nicotine, if you like. If nicotine from tobacco smoke's a 100-watt light bulb, this is about a 50-watt light bulb. It's enough to keep you out of the dark. Okay. It works. How does it work? It works by alleviating symptoms of withdrawal, craving, and other withdrawal symptoms, making quitting easier. That's all you have to remember. How does NRT work? NRT works by alleviating symptoms of withdrawal, making quitting easier. How does Zyban work? Zyban works by alleviating symptoms of withdrawal, making quitting easier. That's all you need to tell your patients. Please don't say, Champix is a partial nicotinic acetylcholine receptor specific for the alpha-4 beta-2 subtype. It has both agonist and antagonistic properties, because that is just going to go down like a ton of, well, whatever you want to say. So just keep it simple. Keep your messages simple. It does work. It at least doubles your chance of quitting. And again, it's for smokers. And do I have that? Yes, here we go. So here's the fine print for the special authority. You have to be using this as part of a support package. So you're meant to be getting some behavioural support with it, whether that be delivered by a nurse or the Quit Line or Okati Kaipipa or whoever else. It's not available for use in pregnant women, nor is it available for use in people under the age of 18. So adolescents, it's not licensed for use. And here's the bottom line. People have to have tried twice on NRT and failed. Now, you don't have to have any documented evidence of this. So you could say, you've tried NRT twice, right? I think a lot of the smokers that we see will have done that already, or they have tried with Zyban and failed, or they have tried with nortriptyline and failed. It's not you have to fulfill all of those and failed. So failed twice on NRT, or failed on Zyban, or failed on nortriptyline. And if they meet that, they're fine. Okay? Who can you use it in? Otherwise, this drug doesn't have any contraindications really, except if they're pregnant, age under 18, or allergic to this stuff. You can use it in people with mental health illness, but you just have to be extra careful with them. Just monitor them. Most common side effects: nausea, vivid or very strange dreams, and some people report mood disturbance. Okay. Now, this isn't unusual in smoking cessation because stopping smoking causes mood disturbance. So we don't know whether it's a drug effect or just an effect of stopping smoking. Best advice? Let me know if you have any problems or your mood changes, and you just monitor them and follow them up. Nortriptyline, I don't think that we use much of this anymore for smoking cessation. I'd use this in less preference to bupropion. Bupropion is much easier to use, but some doctors still do use it. It roughly doubles your chances of quitting, just like Zyban does. So here's bupropion or Zyban. This is what my dad used. He loves it. It's quite funny listening to people. He goes, you know what, NRT I tried numerous times, and every time I was with my friends that were smoking, I used to get an urge to smoke. With this, I can be around them and I don't have an urge to smoke. And he's already asking me, so how long can I use this for, and when can I get an extra supply? So people have different reactions to a whole lot of different medications, and whatever works for the person you're dealing with. It does have a number of contraindications and cautions. You don't have to know what they are, but the prescribers do. Common side effects: headache, dry mouth, difficulty sleeping. Now, ABC approach. We've all been in there doing this ABC thing. Is it a bit like pushing a car that's, is it sort of a bit of a facade? Look at our nice car, but someone's having to push it. And someone asked me at a conference recently, yeah, but are people just cheating? Is it just a box-ticking exercise? We've got this big drive, and I had a story, someone said to me today, I had a patient who was airlifted out of Christchurch, and one of the first things that he got asked when he got admitted to our hospital was, did he smoke? What a ridiculous thing to ask. And that's not how it's meant to be going or meant to be perceived, but that's how still people perceive this whole thing.